next presenter now. So this is Alison Stirton-Croft, and they will be presenting on maximising our peak flow, how QI supported a redesign of community pulmonary rehab services in Milton Keynes. So Alison, when you're ready.
Okay, thank you. My name is Alison. I'm presenting on behalf of the Home First Community Pulmonary Rehab team at Milton Keynes. I have myself now moved on, however, the team continues to deliver the service. Starting with some background, in 2020, the pandemic led to instant pausing of all pulmonary rehab services. Previously challenged waiting lists grew, and during this time there was minimal provision to manage the caseload. Commencing around March 21, it was essential to move swiftly to restart pulmonary rehab services at the earliest and safest time. It's widely known of the benefits of pulmonary rehab, in particular for COPD patients, plus this cohort of patients also suffered hugely from deconditioning as a result of the pandemic. Our aim was to clear historic waiting lists, and furthermore that by the end of 2022, all new referrals would be seen within 90 days of receipt of referral. Supported by a QI project manager, we were able to identify areas that needed review and testing to accomplish our aims. We worked through 5 key areas with multiple PDSA cycles, changing and retesting ideas to ensure effectiveness. Highlights included introducing an information session for patients, trying different venues, enabling the services to be local and serve areas of high demand with consideration of infection control measures and also public transport. And incidentally, a cost improvement of around £6,000 was made at the end of 2022 on venue hire. Admin processes that underpin the service were streamlined as highlighted. This resulted in time and cost saving and safer processes being introduced. It led to a wider system working with IT to redesign the System 1 templates used. Workforce and skill mix creativity with great opportunities for those in non-HCPC roles is for future developments. And patient feedback, as you can see, has been complimentary and encouraging. Next slide, please. The positive effect of reducing our waiting list is shown in the graphs, with our aim to reduce referral waiting time being achieved. This has enabled us to look wider across the Bedford, Luton and Milton Keynes systems and support other service providers as per the spikes in the referrals. As we know, QI is a continuous process and we continue to review and build on our improvements. Our future aims include increasing the workforce and being able to move forwards towards the service being accredited. This will be enhanced by the learning process and methodologies that we have put in place as a result of this QI project. Thank you.
Great, thank you very much, Alison. Jenny, any questions?
Thank you, Alison. Yeah, Alison, can you tell me how did you understand the patient's perspective on this pathway?
Sure. So I've worked in pulmonary rehab for a number of years. So I'm very aware of obviously the feedback that patients provide, the improvements that they make within their own sort of functional status. So we knew that getting them in was really important. Obviously, there have been phone calls during the pandemic to see how they could improve themselves. A lot of the feedback was they weren't seeing clinicians face-to-face, GPs or other professionals, and they were a lot weaker. So that's why we knew that we had to, first of all, get things started, obviously with national guidelines as well for pulmonary rehabilitation. And then we actually had a course that ran longer than the course that was pre-pandemic in order to account for sort of some of that deconditioning that happened as a result of inactivity during the pandemic time. The feedback was obviously a bonus. We knew that we got lots of fantastic feedback previously, but there was some direct comparisons for patients who had done the pre-pandemic course to a post-pandemic course. There had been a massive change in the workforce and the service that was delivering it. It was recommissioned by a different service in Milton Keynes, a provider in Milton Keynes. So it was really nice to see that direct comparison as well for some patients who could, easily reflect on the two.
Okay, thank you. And having done a full QI project, can you tell us which QI tools you found most helpful and why?
Sure, I find the PDSA cycles are really helpful, partly because we have a very small team. There's one qualified physiotherapist and then admin and non-HCPC registered technical instructors. So it's a really nice, relatable sort of tool to use, irrespective of your background, be it professional or non-professional. And also it enabled us, I was very keen to say to the team, it's about the little 1%. So obviously with the PDSA cycle, that you can be sort of testing and rejigging those to make sure that you're getting the best service at the end.
Thanks. And what do you think's been your key learning from this project?
I think, unfortunately, I was quite new to the area when I first started. So actually networking would have been a bit more sort of helpful. And also particularly the system one. So getting the IT structures in place. That's been a massive learning point. We've kind of gone a little bit, we changed the assessments initially onto Word and then approached the system one templates, whereas perhaps that would have been better just targeting the system one the first. Maybe saves a bit of time. It's just so much to do all at once though.
Thank you, Alison.
Thank you, Alison.